Welcome back to Singapore Property Talk Law. Today we're diving straight into the latest on COVID-19 here in Singapore.
Yeah, based on the recent updates we've seen.
Exactly. You've probably seen some headlines about case numbers going up again.
Hmm.
So our goal here is just to give you a quick, clear picture of what's happening, what this current trend actually means.
Right. Cut through the noise a bit. So looking at the numbers, there's definitely been an increase. For the week of April 27th to May 3rd, 2025, the estimate was around 14,200 cases.
Okay, 14,200. How does that compare?
Well, the week before that, it was about 11,100. So yeah, it's a noticeable jump.
Right.
And we also saw a bit of a rise in the average daily hospitalizations, went from about 102 up to 133.
Okay, so cases up, hospitalizations up.
Yeah.
That sounds... Well, it sounds concerning on the surface. Is it time to worry again?
Well, here's the interesting part. Even with hospitalizations up slightly, the average number of people needing intensive care, the ICU cases, actually went down a little. Yeah, from an average of 3 per day down to 2 during that same time frame. And importantly, the authorities are saying that, the hospitals are coping. They can manage this increase currently.
Okay, so the system isn't overwhelmed. That's a really key piece of information.
Exactly. More demand, yes, but manageable.
So more people getting it, but maybe not getting as severely ill. Is that fair to say? What about the variants driving this? Anything new or nasty?
That's the other bit of, reassuring news. There's really no indication right now that the main variants floating around, mostly LF.7 and NB.1.8, are more transmissible or causing worse disease than what we've dealt with before.
LF.7 and NB.1.8.
Okay. And the interesting thing is both of them are basically descendants of the JN.1 variant.
JN1. That rings a bell. Why is that significant?
Because the current COVID-19 vaccines, the ones available now, they're formulated using that specific JN.1 variant.
Oh, okay.
So because these new circulating ones are close relatives, the protection you get from the vaccine, especially against getting seriously sick, it still holds up pretty well. Your body recognizes them.
Right. That makes sense. The vaccine is sort of primed for that family of variants.
Pretty much.
Okay, so if the virus isn't necessarily scarier, why are we seeing this jump in infections now?
It comes back to the fact that COVID-19 is acting like other endemic respiratory illnesses. We expect these kinds of periodic waves. It's just the natural rhythm of these things.
It's like the flu season, sort of?
Exactly like that. And one likely factor contributing now is probably a bit of waning population immunity. Think of it like the protective shield from your last infection or vaccine, gradually getting a little less strong over time.
Okay, so it's partly just the expected cycle and our collective immunity dipping a bit naturally.
Yeah, that seems to be the main thinking.
So what's the guidance then? What should we be doing, particularly with vaccinations?
Vaccination really remains the best tool we have to protect against severe illness. The strong recommendation is for an additional dose, especially for those at higher risk.
Who falls into that category again?
That's people age 60 and over, anyone who's medically vulnerable with underlying conditions, and also residents in aged care facilities. For them, getting another shot about a year after their last one is advised.
About a year's interval. Okay.
Yeah. And of course, healthcare workers and people living or working closely with vulnerable individuals, they're also really encouraged to stay up to date with their vaccinations.
Makes sense. What about everyone else? Younger, generally healthy people?
Well, anyone aged 6 months and up can still get vaccinated if they want to. It's available, and it still offers a layer of protection.
Right.
It's more of a personal choice for those not in the high-risk groups, but certainly an option.
Got it. Vaccines still important, especially for some. What about just day-to-day stuff? What precautions should we be thinking about?
It really boils down to that personal and social responsibility we've talked about before. The simple things.
Like hand washing.
Exactly. Good personal hygiene, washing hands often, covering coughs and sneezes. That basic stuff still works. And if you do feel unwell, even if it's just mild symptoms like a runny nose or sore throat, it's really wise to maybe minimize socializing, put off non-essential trips if you can.
Yeah.
Just helps stop the spread.
Right. Common sense, really.
And masks.
Yeah.
Wearing a mask if you're in a crowded place, or definitely if you are symptomatic, headache, fever, cougher. It's a good way to protect others and yourself too.
Okay, so let's just pull this together.
Yeah.
We're seeing more COVID cases in Singapore right now.
Yes.
But the variants don't seem more severe. Hospitals are managing okay.
Correct.
Vaccination is still highly recommended, especially for vulnerable groups, about a year after the last dose.
Mm-hmm.
And the basic precautions, hygiene, staying home when sick, maybe masking in crowds or when symptomatic. These are all still very relevant.
That's the gist of it. It's about staying aware, taking sensible steps. We're living with this as an endemic illness now, so these fluctuations are, well, part of the landscape.
Yeah, it reinforces that these things will keep circulating.
Yeah.
It's not necessarily a crisis, but just the ongoing reality.
Exactly. Keep informed, take reasonable care.
It definitely makes you think about how we manage all sorts of respiratory illnesses going forward, doesn't it? It's an ongoing conversation.
It really is.
Okay, thanks for breaking that down for us today. A good, quick snapshot to keep everyone in the loop.